Hello everyone, this is Leadership Roles and Global Trends Output Activity or Group 1. Our group have divided this activity into 4 parts. The first part is case scenario, the second part is why the case is related to the literatures. The third one is how to utilize the literatures. The fourth is challenges in the leadership roles of nurse. Let's move on to the first part, case scenario. Patient female, 54 years old, a junior high school teacher in China. She was admitted to hospital on June 20. After coughing and expectoration for more than 10 years, accompanied by wheezing and shortness of breath for 3 years, and aggravation for 4 days. The patient is a chronic cough line for more than 10 years. In recent 3 years, gradually feel shortness of breath, chest distress, activity when more serious. 4 days ago, due to the cold after coughing, sputum increased, cough, a lot of yellow thin sputum, cough phlegm, obstruction paired up with chest stuffy short, unable to sleep, appetite decreased significantly. The physical examination has shown that the temperature is 37 degrees Celsius, the pulse is 106 times per minute, and the respiratory rate is 26 times per minute. The blood pressure is 120 over 80 millimeter of mercury. Prolonged expiratory time accompanied by asthma, cyanosis, self-induced fatigue, difficulty in speaking, barrel-shaped chest, wet rills into middle and lower lungs were detected by auscultation. No obvious abnormalities were found in other physical examinations. The laboratory test has shown that the PO2 is 78 mm of mercury. The PO2 is 50 mm of mercury. The chest X-ray revealed increased lung field light and lower diaphragm.
In this part, we will talk about why the case is related to the literatures. From the scope of COPD that mentioned in the literatures, we can know that patients who are exposed to the risky factors can contribute to the development of COPD. So let's have a review of this case. This patient is a junior high school teacher in China, and we all know that the tools that Chinese teacher use is chalk, which means the patient has been exposed to the occupational dust for a long time. This is consistent with what is mentioned in the literatures. Up to now, we know that this case is related to the literatures. So let's move on to how to utilize this. This literature tells us how to prevent, treat, and control it. As a nurse, take care of this patient in the following 3 aspects. First, avoid exposure to the dust again and avoid recurrences. Second, long-term oxygen therapy. Last, give patients expectorants, and we will talk about it one by one. First, avoid exposure to the dust again and avoid recurrences. At this stage, when we're caring for this patient, we try to avoid the patient's exposure to the irritating factors as much as possible to reduce the number of patient's morbidity. The irritating factors we mentioned here is dust.
The second one is long-term oxygen therapy, LTOT. Cousins said that when appropriately prescribed and correctly used, LTOT has clearly been shown to improve survival in hypoxemic COPD patients. And he also said that the minimal recommended duration of LTOT is 15 hours per day. thus representing inadequate oxygen adherence, and it has been established and defined by international guidelines on domiciliary LTOT. This patient is a teacher and has COPD, and she needs long-term oxygen therapy for her COPD, also for her hypoxemia, and the oxygen flow is 1 to 2 liters per minute, and use the nasal catheter. The third one is give patients expectorant. Wahani says that giving nebulizer and infective cough in COPD patients to facilitate the clearance of bronchial, those help can control the inflammatory process and improve the function of ventilation. And if action to the combined nebulizer and infective cough form of ventilation can increase the function. And John says that it is more effective to improve the clinical manifestation of patients with COPD using Ambroca's hydrochloride combined with oxygen driving, automation, inhalation, and general nursing, which can achieve earlier rehabilitation. And from the case, we can know that this patient has cough and expectoration more than 10 years, and she needs the medicine for expectoration. Use the medicine and combine with infective cough can really help her COPD. Part 4. Challenges in the leadership roles of nurse. In this part, we are talking about two challenges. The first one is low occupational well-being of nurses when nursing patients with respiratory disease. And the second one is the large workload of the respiratory department but few nurses. Xie Hongzhen said that theorists advocate that people-centered care should be taken in the care of patients, as well as in the management of care. So let's talk about the two challenges one by one.
The study found that the professional well-being of nurses was the main factor affecting nursing management. But for nurses, occupational well-being is not only a reflection of hospital satisfaction, but also a matter of personal quality of life. The influencing factors of occupational well-being include work environment, patient's identification, and wage level. In terms of working environment, nurses in respiratory department need to get sufficient logistic support, such as arranging professional managers to assist in administrative work, which can ensure nurses' concentration in nursing. Good working environment is conducive to nurses working in a happy mood, but also can promote the recovery of patients. And in order to increase patients' identification with nurses, nursing managers can strengthen external publicity, increase people's understanding of nurses and nursing, improve the social standards of nurses, and enhance their professional identity and pride. At the same time, managers should yearly encourage and identify with nurses and give them confidence in their work. But actually, many nurses find that the salary is not ideal after hard work, so they may have a negative attitude towards work. Then managers can improve nurses' satisfaction with pay level through performance appraisal. If we participate in the rescue of patients with asphyxia, carry out lectures on respiratory disease, and strictly implement the principle of multi-quality work, they must give more. In the medical staff, nursing staff is a large group. Due to the decrease of nursing staff, the workload of nurses increased sharply. Long time and high load work not only damages the physical and mental health of nurses, but also leads to the decline in nursing quality. Nurses can increase health education for patients and guide patients to self-care. For example, guide the patients to wheeze and cough, and assist their family members to carry out chest perfusion expectoration. Studies have shown that highly cooperative self-care between patients and their families can not only reduce the workload of nurses, but also improve the quality of care at discharge. And the aging nurses is also a big challenge in nursing management. Elderly nurses generally have rich nursing experience and deep professional love, but some nursing knowledge is backward. Physical strength and energy are not enough to complete the increasing work. Every year, many nurses around the world are retiring, and many times they are waiting for the election. However, many people still choose to continue nursing after retirement. For these people, employment policy can be implemented. They can be hired to teach high quality nursing courses for new nurses and reduce the workload of general nurses. They can also be placed in departments and don't require too much energy, so that departments with heavy workload can have more young nurses. That's all. Thank you.